Hello there. I am Mary, and I'm going to teach you how to navigate our website, fambase.org. That's FABM BASE.org. If you are using hormonal birth control and considering making this switch to fertility awareness or natural family planning, or maybe it's just been recommended for you or prescribed by your doctor, and you want to learn a little bit more before you make an actual decision. All right, our website can serve you really well here. Okay, so if you open up our website, fambase.org, the first place I would recommend going, if you hover your little cursor over the resources tab, if you're on a laptop or a desktop, if you're on your phone and you open up our website, there's three little lines underneath our logo. You'd click that to get access to the different options or the different tabs. So you click resources and then you go down to how hormonal birth control works. This little page is like my baby. I had so much fun with this page. I think it's so important. It's important to Emily and I to talk about informed consent. And that's why this page opens up with make an informed decision. You cannot make the best decision for yourself until you have all the information on all your options. And when we go to the doctor, lots of times the appointments are really short. Birth control is pretty much widely accepted for various reasons across the board. So this side of the story is often not explained to us. And this is why it was so important to us to have this on our website so that anybody can access this information. Okay. So we kind of describe that here, opening up that it's prescribed to many women to avoid pregnancy or manage symptoms. But how does it work? And so we start off by explaining how hormonal birth control works, but we can't really understand how hormonal birth control works until we understand how our menstrual cycle, our reproductive cycle works. So that's where we actually start. So you get a nice little explanation here on the left-hand side. If you are listening to this on podcast, by the way, you can access what I'm showing you how to work through this website on YouTube. So it starts in the brain, and we kind of map that out here. If you keep going, we give an explanation, a little bit of history. We try to keep it as brief as possible. And by the way, our goal in creating this part, I mean, all of us have our own biases, but we really wanted this to just be factual and objective. We're not trying to sway anyone in their, making their decisions. We just wanted to say, like, this is what's actually happening. And this is usually the part of the story that you don't hear. So we talk about when birth control was first created. We talk about breakthrough ovulations. These can happen when you're on birth control and what that means. And we give the stats and the reference to support that, where we got that information. And then what would happen if you did have a breakthrough ovulation? For example, if you're having intercourse, what it does, what birth control, how it affects cervical mucus and the lining of the uterus. So you're getting a lot of education on this page, but also a lot of references. We talk about the IUD because the primary mechanism of action for the IUD is actually a bit different than the mechanism of action for oral birth control, for example. But we think that that's really important for women to know before they make a decision. And so another interesting thing you're not going to find a lot of people talk about down on this page is that, say that you're aware of these breakthrough ovulations that they can happen, and you are having sex, and you're aware of this secondary mechanism, which can terminate a pregnancy. It is possible to use fertility awareness to be able to identify if you are fertile and avoid intercourse on those days, even if you're using birth control. I know this is kind of maybe a little bit controversial, but I have done it as a Creighton practitioner just a few times. I know a friend of mine has helped women, whether it's hormonal birth control or having IUDs. I have done this as a Creighton practitioner successfully. Okay, so there is some room here to explore. And I want you to know it is possible. If you believe there is a reason for you to be on birth control, but you'd like to chart, you can do both. I mean, at least generally speaking, it is possible, I want to say. Then we explain how pill bleeds are not periods. A lot of women are under the assumption that the bleeding that they have when they're on the pill is an actual period. It's very different. So explain that here. And then another misunderstanding is that birth control will treat unwanted symptoms but it does not treat the underlying cause that is of the symptoms. If a woman is experiencing something that is uncomfortable for them, whether that is something, as minimal, not that it's always minimal, but acne or severe pain, it's just suppressing those symptoms. And then obviously birth control does, it can bring its own set of symptoms. So we list those there. And we just really want to be very clear at the bottom here, regardless of which method you choose, and for whatever reason, be fully informed. There are difficult aspects of every option, from birth control to fertility awareness. So it's simply a matter of what the woman is willing to give up. A truly empowered decision cannot be made without having all the information. Okay, so that is going to give you a little bit more information on hormonal birth control. Then I would recommend you go back to resources and learn about what is fertility awareness. So you can access what is fertility awareness on our home page, or you can access it here in resources. So I'm going to click what is fertility awareness, and that is going to open up this new page. Okay, we worked really hard on this page too. Again, just to objectively break down what fertility awareness is, what NFP is, and again, trying to capture as much nuance as we can. So here we kind of explain the signs of fertility that are used to determine the fertile window. We also call these biomarkers. We explain some biomarkers that can be used to evaluate the health of the menstrual cycle. This is not something you're going to hear often out, mainstream in the culture, but there's a lot of biomarkers that we can identify that tell us about the woman's health. And so we want to make sure to put that in there. We talk about the information women collect through charting and the 3 purposes it can serve: basically family planning, and to avoid pregnancy, to achieve pregnancy, or to maintain health. It helps direct evaluation and can help with diagnoses. The charts do not diagnose themselves. Then there's a lot of different conversations or debate about what these different terms mean. And it can be kind of confusing, but Emily and I have broken this down based on our understanding and talking to a lot of different women. The difference between NFP, FABMs or fertility awareness-based methods, and FAMs, fertility awareness methods. We have a little definition of what is NFP. So helps you learn more about this. Then we talk about determining the fertile window and an understanding that men are always fertile. So we don't want to leave that part out of the conversation. A little bit about sperm and how long they live, and cervical mucus, how long the egg lives. So this is just basic science, guys, that we want to give you access to here. And then if you want, you can open up this tab for a more in-depth breakdown of just, kind of how all this works, shared responsibility, just a little more nuance that you don't always get in these difficult conversation. And my favorite tab here on this page is the ovarian hormone benefits. We often talk about what birth control does and how that affects our bodies. And since it's synthetic hormones, there can be some harmful effects. And a lot of people don't understand how good it is for the body when it naturally produces estrogen and progesterone, regardless of the intentions for pregnancy. So here we have a breakdown of this. I get this from this Laura Bryden blog called The Secret Powers of Ovulation. Once I found it, it's been like my go-to blog. So you can get access to a link here, and it shows the short and long-term health benefits of estrogen and progesterone, which is only produced by ovulation. So it's just some food for thought there. Is fertility awareness effective? This is a really important breakdown of how to understand statistics when it comes to understanding the effectiveness at avoiding pregnancy for NFP or fertility awareness methods and other types of birth control methods. It's a little oversimplifying it just to look at the stats, the number. So we do you a great favor here by explaining what to consider when looking at these stats. Really valuable information here. We're not just giving you numbers, we're explaining what these numbers mean. And then you can interpret this and make the best decision for yourself. Okay, some of this we got from Louise Boychuk. She has a great article here and describing that a large discrepancy between perfect use and typical use rates for medical treatment would be a bit of a red flag. So just a little bit about how you can use that information. Again, we don't want to leave out that using fertility awareness, NFP, is difficult. but it's worth it. We want to be honest. It's not just natural birth control is just a little oversimplifying it. This is hard work, but there are a lot of benefits to it. So again, seeing both for what they're worth, and then you making the decision that is best for you and your family and where you are in life right now. You need all the information to be able to do that. And we are hoping to provide you with that, or just be at least a little bit of a help on that process. Again, fambase.org, FABMBASE.org. Take a minute to scroll around on your own and be on the lookout for more episodes like this, where we help you to navigate our beautiful and comprehensive website. Y'all have a good day.